So when you're discharged home, there are some restrictions. I don't want the child bed rest by any means. Up and around is more important. And any one position for a prolonged time will cause discomfort. So you want to change from sitting, standing, walking, even laying down for a period of time. During sleep, it might be somewhat discomforting. You have to change positions. But bed rest is probably out of the question, as you'll get real stiff and more discomfort will occur. Basic restrictions include, I don't like repetitive bending at the waist. No running or jumping, which no one's going to want to do for the first couple of weeks, but you'd be surprised how quickly they recover and want to increase their activity. So after several weeks, it turns out we're just kind of holding them down. And no lifting heavier than 5 pounds or so. So no running, jumping, repetitive bending at the waist or lifting over 5 pounds is basically just the simple restrictions that are necessary. This is not a very restrictive procedure. It's not destabilizing in any manner. And it doesn't limit you very much. Home health will typically see you in the hospital prior to discharge and discuss things you might need after surgery, such as a shower chair or a bedside commode and things of that nature. The bandages, like I stated, was provided prior to discharge. However, if it rolls up or loosens in any case, it's just reinforced with a typical surgical tape, or you can call the office and we can discuss what would come next. While your child's in the hospital, either myself or my staff will see him or her every day to assess the symptoms, the pain, and how we're progressing postoperatively. The bandage that's applied prior to discharge can at times roll up on itself, in which case I would just reinforce it with a type of surgical or hospital type tape. The bandage is waterproof and you can indeed take a bath or get it wet. I would suggest a shower chair rather than submersing the dressing in water. Once discharged at home, you'll be receiving pain medication prior to discharge. The same medications as you're provided during the hospital stay. And we slowly wean from those medications. It's pain medications, sometimes a muscle relaxant. They're strong medications to some degree, but they're typically not needed after 7 to 10 days. So by the time you see me on your post-op visit, you're either weaned off it or maybe just taking it at night. So it's not as a major concern. I'm more concerned that he or she is mobilizing themselves, since this is not a bedridden or immobilized type of post-operative condition, and mobilization is the key to success.